New South Wales child abuse squad after her treatment plan allegedly left a baby boy close to death. It's reignited the debate over regulation of natural practitioners.
No parent wants to see their child suffer, but what if the treatment you choose makes the condition worse? Police allege that's what happened to an 8-month-old who was taken to a naturopath for eczema but wound up in hospital with severe malnutrition. Both the naturopath and the baby's mother have now been charged after allegedly withdrawing all medical care in favour of alternative therapy.
There are two major dangers with unqualified people calling themselves naturopaths or herbalists. And the first one is where they abandon their conventional treatment, and the second one is where they are given an inappropriate complementary or alternative medicine.
The dangers are that people can't have confidence at the moment that if someone says that they're a naturopath, that they are in fact appropriately trained, that the title of being a naturopath isn't protected in that way.
Naturopaths believe diseases can be treated or prevented without Western medicine. There's good scientific evidence for some aspects of naturopathy, like diet and exercise, but there's no evidence to support other natural therapies, including iridology and homeopathy. This tragic case has renewed calls for tougher regulations.
The standard of regulation is manifestly inadequate when it comes to natural therapies, and particularly with naturopaths.
Not everyone thinks registration would work, although there's broad agreement for minimum safety standards.
We don't know how widespread the problem is. Ideally, it's not. One case is too many.
Doctors say the message is clear. Just because a treatment is natural doesn't mean it's safe, and patients should always seek a medical opinion.
John Wardle is an accredited naturopath who's been calling for tighter regulation for years. John, how much training do you think it should take to become a naturopath?
Well, the current level of training in the university sector, the degree granting sector, is 4 years, and I think this is pretty much a well-established minimum, and every government report over the last 20 years has said this really should be the minimum. So, you know, realistically, this training's existed since 1996. I think that's where we need to be heading.
John, would you agree that the definition is a bit too broad, or you need to change your title, perhaps? Because a lot of things that fall under the heading of naturopathy, let's be honest, are rubbish, aren't they?
Well, yeah, and this is one of the problems with having a title like naturopathy, a recognised brand that's sort of co-opted by people with fake education, people with no education in naturopathy, people with, you see a lot of deregistered doctors that perhaps might resurface as naturopaths. It's become a bit of a dumping ground, I guess, for anything that's alternative.
Now, John, if you had a patient who was not responding to natural treatment, what would you do? I mean, at what point do you decide you're sending them off to a conventional doctor?
Look, I think if you look at naturopathic training, most naturopaths that undergo the accredited training, they do the same level of pathophysiology, pharmacology, chemistry, differential diagnosis as any allied health practitioner. So really, their scope of practice is really, they should know their scope of practice and their limitations, and when they aren't getting the results or they can't get the results, that's really when they should be referring.
Yeah, well, it's hard for us to know, though, because if they're dodgy, they're not going to know their limitations, are they? Isn't that the problem?
And this is one of the big problems with the current self-regulatory arrangements too. Generally, the people that are happy to identify themselves and join these schemes that actually help to support standards aren't the ones we have to worry about. The ones we have to worry about are really the ones that sort of hide, you know, they hide, it's the black market of naturopathy, I guess.
All right, John, it's a tricky area. Thank you so much for helping us through.